Come in. Hi.
Welcome back to the office. It's been a while since we saw you last.
Yeah.
How are you doing?
I'm doing well.
Yeah? So what brings you in today?
It's my ankle, my right ankle.
Mm-hmm.
So I sprained it about a week ago while I was exercising. There's this jumping motion that, like when I landed, it sort of landed wrong, and I felt some initial pain here on the inside. I didn't think much of it because I was still able to walk after. But today morning, I sensed a sharp pain that kind of went down here to my toe, and a slight numbness also that followed. So, yeah, that was sort of concerning. I wanted to get it checked with you.
All right, for sure. So I'll definitely take a really close look at your ankle. I just want to ask a few more questions first. All right, so where did you say the location was?
So it's over here, starts over here, and goes down like that.
Okay, so when I press on it right here, what does that feel like?
Oh yeah, it's really tender.
Okay.
Yeah.
And what was the sensation you said that like radiates down?
It's like a sharp pain that just kind of shoots down. Yeah, and with some numbness.
Okay, I got you. And when did you say exactly this started?
I noticed this today morning.
Okay. Do you have like an approximate time?
9 in the morning.
Okay. Have you ever felt this sensation before?
No.
And you said that last week you had an ankle sprain, right? And that was that around the same location as well?
Yeah. Sort of landed weird where, kind of my ankle went in. If that makes sense.
It's kind of like turned in that way?
Yeah, like a twisting motion.
Right, right, that makes sense. So that was last week. Have you ever had a sprain like that before?
Not on the inside. I've sprained this part twice.
Okay.
But this is new. Yeah.
So lateral ankle sprain twice in the past. And when did that occur?
Should be about 2 years now.
All right.
2 years ago and then 3 years ago.
Okay, got it. Did you notice any swelling, any stiffness of that area? Or any?
There's definitely some swelling here for sure, yeah.
Okay.
And in terms of stiffness, I'm just afraid to, give it any pressure.
Right, that makes sense. Okay, so there is swelling and afraid of pressure. Did you notice a fever at all?
No.
No? Okay, we will check that as well, just to be on the safe side. Are there any activities that you can't do right now because of this pain?
Some motion with my feet, this foot. For example, like tippy-toeing, that's really hard right now.
Okay,
Yeah.
anything that has to do with tippy-toeing. So do you find that, are you able to walk properly?
Somewhat, but restricted because I'm afraid of,
Okay, yeah.
Yeah, more swelling.
What about climbing the stairs?
It's sort of, yeah, it's okay.
Are you able to dress yourself still?
Yeah.
You're very well dressed today. All right, for sure. And I'll definitely check on your gait as well and on all of those things. Let me just see. Have you tried exercising on this ankle yet since last week when you sprained it?
No, I haven't.
So you've been mostly resting it?
Yeah, just to be on the safe side.
Okay, good. Okay, and you said that you sort of twisted it again. Can you show me again which way you twisted it?
It was like, oh, yeah, like inwards.
Okay. Yeah. Good. And before your workout, did you do enough, stretching and warming up?
I could have done more, I'll be honest, yeah.
And which shoes did you wear for this workout? Was it these ones?
Yeah, I did wear these, yeah.
Do you mind if I take a look at your shoe?
Mm-hmm.
Let's take a look here. And you don't wear any orthotics, it seems. Okay, and these are running shoes. Doesn't look like there's a lot of wear and tear. There's a little bit of wear here.
Yeah, it's fairly new.
Okay. Okay, great. Actually, I'm going to have you take off both of your shoes now that we're starting our exam.
Thanks.
I'm going to have you place this under your tongue, close your mouth, and just hold it with this hand over here. Right. I'm just going to take your pulse, okay? Thank you. So you don't have a fever, and that's a good sign.
Mm-hmm.
That's all I need for now. Can you please place your purse over there on the side? I'm just going to have you lie down.
Okay.
Great. All right, Ediya. Would it be okay if I took off your socks?
Yeah, that's fine.
So this foot right here, and you were saying this area. Okay. So I want to start by just inspecting the foot. I'll just go a little bit higher as well. And I will inspect them symmetrically, both sides. Okay. So yeah, there is a little bit of swelling here and a bit of redness. Definitely notice that. Is there pain here when I?
Yeah, a little bit.
Yeah. Okay. Right. Let me know if you feel any pain or tenderness anywhere I'm palpating, okay?
Okay.
Just palpating the medial malleolus here to see if there's any.
That's a little bit tender.
Just down here? Okay.
Yeah.
But the bone itself, do you notice anything?
The bone is fine. Yeah.
Okay. Doesn't seem to be any signs of fracture. Let's check the lateral malleolus. What about here?
Seems to be fine.
Okay. In this area?
Yeah, that's okay.
Okay. Just take out my notes so I make sure I know what I'm talking about. Alright, so anterior talofibular ligament. Any issues here?
No.
Okay. And what about back here at the Achilles tendon?
No.
I see a little bit of bruising, but no signs of scarring. Okay. Now the talus area. The talar bones, including the navicular bone, the cuneiform and cuboid bones. Then the metatarsal bones. Just going to squeeze them each. Let me know if you feel any pain or tenderness. Okay. And the joints here. Okay, and the phalanges. I'm also going to look at the sesamoid bones down here, the first metatarsal, base of it. Any pain down here in the plantar surface?
No.
Okay. So no signs of plantar fasciitis. That's great. What about here in sort of the heel area, calcaneus?
No.
Okay. All right. I'm also going to check the other side. So no swelling or redness on this side. A few bruises along the shins as well. Actually, just a little bit of discoloration. And you've never had any issues with this foot?
No.
Okay. How is it here?
It's fine.
Okay. And again, the talar bones, talus, lower part of the tibia, medial malleolus, and the lateral malleolus and fibula. All right, great. So Ediya, now we're going to do some range of motion, okay?
Mm-hmm.
So I'll guide you along. For this one, I don't want you to move at all. I'm just going to passively move the joints.
Okay.
So this is dorsiflexion. Any pain?
No.
Any pain?
No.
Okay. How does this feel?
It's okay.
How does this feel?
Slightly painful.
Okay. And where do you feel the pain?
On the inside of the ankle.
The same area as before? Okay. Do you feel any of that sharpshooting pain at all? Or?
Not at the moment.
Okay. How's this?
That's fine.
And this?
Also fine.
Okay. Is that as far as it goes for you in terms of a little bit more?
Yeah, I think I
Okay. Any pain when I do those two movements?
No,
How's this?
it's fine.
And this?
Also fine.
That? That one? Okay, great. So now let's go with the same foot again. I want you to go through those movements on your own, actively. So go ahead and point your toes to your head. Good. And then to me. Great. And then I want you to, yes, invert your foot. Okay. And evert. Any pain during those movements?
No.
And now I want you to bend your toes upwards and then all the way down. Point them. Great. Okay, I'm going to do the same. Just wait for the cars. Okay, we're going to do those same movements over here on this foot. Okay, so again, I want you to point your feet all the way up towards your head as far as you can. Any pain there?
No.
Okay, now all the way down.
This is where I'm having trouble.
Is that painful for you? Okay. All right, so yeah, so you're only able to go about 15 degrees or so before you start feeling pain. And now why don't you do the eversion, so kind of turn it outwards. How's that?
That's okay.
And then the other way.
The other way is a little difficult.
Is it painful as well?
Yeah.
Okay, so you're not able to have full range of movement, just about 5 degrees or so. Okay. Good. Let me just write all those down. So 5 degree inversion of right foot and about 15 degree plantar flexion of right foot. Others are within normal range. Okay, great. Now I'm also going to do resisted range of motion. So I want you to just push your foot towards my hand, so just push down. Great. Push up into my hands. Great strength there. And then now towards this, kind of turn your foot inwards. Yeah, there you go. And then this way. How's that?
That was fine.
Alright, we're going to do the same thing on this foot. I'll support your ankle joint while we do this.
Okay.
Push into my hand. Are you able to?
Not as much as the other foot.
Yeah, you have very little strength here. Is it also because of the pain?
Yeah.
Okay. And now upwards, are you able to do that?
Yeah, that's easier.
Okay, it is still a bit weaker than the other side, but it's definitely stronger than the plantar flexion. Now let's do eversion, so turn your foot out into my hand here as much as you can. Are you able to do that?
It's difficult.
It's a little weak, yeah. Now inwards. Yeah, you're also weak on that side as well. Okay, let me just write that down too. Okay. So weak. Resisted range of motion. And plantar flexion. The right foot due to pain. Okay. Alright, Ediya, now I'm going to be testing some of your nerves.
Okay.
And then we'll move on to some special tests.
Okay.
Alright, Ediya, I'm just going to, is it okay if I bring your pants up just about mid-thigh? Alright. And now I'm going to have you close your eyes, and I want you to let me know if you feel the same sensation on both sides or different. And then if you feel a different sensation on one of the sides, let me know what you're feeling, okay?
Okay.
Right. I'll start here. Same or different?
The same.
Okay. Same or different?
Same.
Okay. Same or different?
That one's different.
Would you like me to try again?
Sure.
Okay, let me just do that one more time. Versus, what is that different sensation? Which side?
On the right side, I don't quite feel I don't feel the brushing of the toes.
Like around here?
Yeah.
Is it sort of numb?
Yeah.
Okay. Okay. Now, what about this?
Yeah. That's definitely different.
So is it also that numbness?
Yeah.
Down here? Okay, versus here.
Yeah, it's different.
So it's also numbness on the right side? Okay. Now what about this? Sorry, let me do that one more time. Versus this.
Yeah, it's the same as the numbness.
The same? And now S1. That versus this. Same or different?
That's the same.
Okay, so we're having L4 and L5, some numbness around the bottom of the dermatome. Just make a note of that as well. At the end of L4, L5 dermatomes, past the metatarsal dorsal metatarsal joints. Okay. All right. So I want to actually check your pulses first before we do some reflexes. I'm just going to check the popliteal pulse. Okay, great. Nice full pulse on that side. Okay, let's check your dorsal pedis on this side. Just going to compare the two sides as well. Just making sure you're getting enough peripheral circulation. Then we'll check the posterior tibialis. I want to check this really carefully because I know you're having pain on this side. I want to make sure the pulse is still present. Okay, the pulse is definitely still present and strong. And on this side. Good, present strong on both sides. Okay. Also just check the temperature. It's a little bit cold towards the ends. Is that normal for you?
Yeah, that's normal.
Okay, I'm just going to check the capillary refill. It's a little hard with this nail polish, but you can still see it. Okay. Capillary refill is great. It comes back in a fraction of a second, so it's really good. All right, now let's do your reflexes. I'm just going to start with the Achilles. Okay. Okay, somewhat diminished reflex there. Then we'll just get it on that side. Okay. Just write this down as well. Diminished patella reflexes 1 plus and 3 plus pulses symmetrical. Okay. All right, Ediya, so now we're going to do some special tests for the ankle. So I want to start with the anterior drawer test. Any pain?
No.
Any pain on this side?
No.
Now I want to do the compression test. I'll actually start on this side here. So I'm just compressing It's called the tarsal tunnel. Let me know if you feel any abnormal sensations.
Okay.
Do you feel anything at all here?
No.
Now on this. So now I'm going to compress the tarsal tunnel here, which includes the posterior tibial nerve. Let me know if you feel anything here.
Yeah, I feel that sharp shooting pain.
Okay, and it's also traveling down here. Okay. Any numbness? Tingling?
Yeah.
Okay. Alright, I'll stop. Okay. Let me also complete one more test. I'd like you to just turn around on face down a minute. Okay. And I'm just going to squeeze. Okay, great. That's good. And while you're here, I'm going to also check some myotomes. So I want you to just push into my hand right here, like on your calves. 1, 2, 3, 4, 5. Great. On the other side. 1, 2, 3, 4, 5. And I already checked the strength of your dorsiflexion, plantar flexion, and your toes, so that's okay. I also want to check the rest of sort of your upper leg. So can you please turn back around? Okay. So I want you to go ahead and push into my hand right here as much as you can, using your knee to sort of push it up. Okay. And over here, sort of like try to kind of kick into my hand. There you go. 1, 2, 3, 4, 5. Great. And now I want you to push up into my hand here. 1, 2, 3, 4, 5. And then over here. 1, 2, 3, 4, 5. Great. So all those myotomes are intact. So, Ediya, I have all the information that I need to formulate your diagnosis. So you can go ahead and sit up, and I'll explain to you the next part.
Okay, thank you.
All right, Ediya, so that is the end of our physical examination. Based on everything that I looked at, it seems like you do have posterior tibial tendinitis. So that is a muscle that goes from sort of back here, like close to the knee joint, and it goes all the way down to the inner foot here. So basically where you were feeling that pain and down to the kind of like the navicular bone. And that muscle is responsible for doing this movement, which is called inversion, as well as plantar flexion, which is this movement. And that explains why you're having trouble doing those two movements right now, and it's really painful for you. So you do have inflammation of that muscle, which seems to have been brought on by the ankle sprain from last week, and now the muscles also being aggravated and flaring up. So yeah, right now it's very acute. It just started today, as you said. So there's not too much to worry about, but I do really want to stress that you need to rest the ankle and not use it at all for the next 3 days. And I want you to ice it for 15 minutes. So you can just use an ice pack, wrap it up with a towel, and ice that area for 15 minutes at a time every 2 hours for the next 3 days. And then I'll follow up with you, see how things are going, see if we need to kind of alter the treatment and start formulating a rehabilitation plan to kind of get, you know, the range of motion of that back. But at this time, we just want to really focus on getting your tendon to heal, essentially, because there are some tears in there, it seems like. I also noticed that you're experiencing tarsal tunnel syndrome. You have this kind of sheath called the flexor retinaculum, which holds, and it's right here, and it holds a number of different veins and arteries, muscles, and nerves. And one of the nerves is the posterior tibial nerve. So it seems like the tendon that's inflamed and swelling is actually compressing that nerve and causing that, like, the shooting pain, the numbing and tingling. Luckily, once the swelling and all that comes down, the inflammation comes down, you should no longer experience the nerve issues, hopefully. But again, we'll check in 3 days and see how things go. Do you have any questions for me?
No, I don't think so.
All right. Well, thank you so much for coming in. Really appreciate it. And I'll see you in 3 days.
See you soon.
Take
Thank
care.
you.
Bye.